We need to prepare the team of people who will move forward the tobacco control, and we need to count on those young researchers and young specialists working on tobacco control. And it's our pleasure to count with so many young researchers in different stages of their career from different places in Europe. And this session will be moderated by a lecturer and researcher at the Alcalá de Henares University, Xisca Sureda, who also kind of did a travel in her research career from PhD training here at the Tobacco Control Unit, and then moving to Madrid to continue tobacco control there and building her team there. So Xisca, it's a pleasure to have you.
Thank you, Elena. It's always a pleasure to come back here at home. So good afternoon, everybody. First of all, I would like to thank to the Catalan Institute of Oncology and the World Health Organization, and especially to Cristina Martinez for inviting me and for organizing that event. The different sessions during the day, we have been of a very high level, and we have all learned a lot and enjoyed listening to great experts in tobacco control. But I think we have now one of the most exciting sessions today. So we have here 5 people, 5 young researchers at the early stage of their careers that have energy and motivation to generate evidence to tobacco to control the tobacco epidemic and translate their results into practice. I'm sure they are very engaged in fighting the strategies of the tobacco control industry to hook newer smokers, especially among new generations. And I really believe that we especially need their voices, because it is precisely young people who can best understand the new generations and the industry strategies aimed at them. I'm sure they can come up with the best strategies to prevent young people from starting to smoke, vape, or strategies to make it easier for those people who have already started to quit. So I'm looking forward to listening to your voices this afternoon, as I'm sure the rest of the audience do as well. So I will introduce the speakers today. So Roberto Valiente from the University of Alcalá. He is a geographer, expert in geography of information technologies, and researcher in health geographics and spatial epidemiology. Roberto is currently assistant professor in the University of Alcalá. Prior than that, Roberto had a postdoc research role in the University of Edinburgh, a School of Geoscience, for 3 years, working with the Spectrum Consortium in several projects, analyzing retail transactions data on tobacco and alcohol sales across the UK. His current research is focused on the study of commercial determinants of health from a spatial perspective, particularly those related with tobacco and alcohol issues. In this commitment, Roberto analyzed the availability, accessibility, and visibility of these unhealth commodities in the space and its relation with population consumption and socioeconomic and health contexts and problems. Rebecca Howell from the University of Stirling is an early career research at the Institute for Social Marketing and Health at this university. She works across the field of commercial determinants of health with a focus on alcohol and tobacco-centered projects. Her recent work involves looking at how nicotine replacement therapies can be used to create smoke-free homes for the benefit of children's health. Rebecca also works extensively with public and patient involvement and has a keen interest in how co-production with lay advisors can benefit research. Ayaka Teshima from the University of Barcelona. She is a predoctoral researcher. She's completing her doctoral studies in the Tobacco Control Unit under the supervision of Professor Fernandez and Dr. Martinez. She has an undergraduate degree in nursing and a master's degree in public health from the Imperial College of London. Her main research interest is measuring the burden of smoking and evaluating tobacco control policies to contribute to reducing the burden of smoking at population level. Nerea Mouriño from the University Hospital of La Coruña. Nerea is a nurse with extensive experience in the UK. She completed a PhD in epidemiology and public health at the University of Santiago de Compostela. Her doctoral thesis explored the effects of pre- and postnatal exposure to secondhand smoke on adolescents' body composition and cardiometabolic health. Since September 2024, she is assistant professor at the University of La Coruña, and she does research on secondhand smoke and the use of psychoactive substance. Sophie Braznel from the University of Bath. Sophie is a research associate in the Tobacco Control Research Group at the University of Bath. She previously studied human biology and forensic science and worked in the health and social care public sector, including secondment at the UK Department of Health and Social Care. In 2023, Sophie completed her PhD on tobacco industry approaches to harm reduction science and whether these approaches help or harm the public health. Sophie has acquired extensive knowledge in head tobacco products and tobacco industry science. So to start the debate, I would like to ask you, all of you, so you feel free to answer if you feel comfortable. So you all have different backgrounds, and according to your CV, you have been using different methodologies to conduct your research. Some of you are more familiar with qualitative data, some other of you quantitative, even systematic geographic systems. Which are the benefits and difficulties when using different approaches, and how to fit the different areas of research methodologies to complement each other? So maybe, Sophie, do you want to start?
Hi, thank you for having me. So my thesis was mixed methods to some extent, but I came from a mainly quantitative STEM background, and the vast majority of TCRG, my research group, are more on the qualitative social sciences side. So I found that transition quite hard. Quantitative research can be quite, what is the word I'm looking for? Sort of square and restrictive, and there is sort of one right answer, and then to enter this world of qualitative research where every answer is both right and wrong was really hard to adjust to. But I found that mixing methods worked really well when you wanted to understand both what and why. And it doesn't always work that, you know, the what might be quantitative and the why might be qualitative. Sometimes it was the other way around. But I found that you can only really get a complete picture by including both areas of research.
Thank you.
Hello to everyone. In my case, I have always done quantitative research, but my research team is doing also qualitative. And I think it's very important to combine both. For one hand, to be able to collect data on smoking prevalence, on second-hand tobacco smoke exposure, or even third-hand tobacco smoke exposure prevalence rates, and also about cessation rates. On the other hand, I also think it's important to do qualitative research to know the characteristics of the users, to know their motivations to try to quit smoking, their difficulties they can find, and also their opinions from those who tried to quit but they didn't manage to do it. So I think that's very important, but I also think it's important to standardize the way data is collected, because we have done some systematic reviews about which questions are used when asking about consumption or second-hand tobacco smoke exposure, and we found that there are huge differences through different studies. So I think it's important to try to homogenize, to include always the verbatim questions, because sometimes we cannot find them, and also this is important, no, for efficient comparison between across studies, across countries, to track changes in the consumption or cessation or second-hand tobacco smoke exposure. And also, I think it's very important to always use the same time frame, for instance, and when using analytical techniques, to also try to use the same, or for instance the cottoning, which is used to measure exposure or consumption, it should be always come from the same biospecimen, because it can be measured in urine, blood, in serum, hair, saliva. Cut points are different, and also the limit of detection from the analytical techniques are different. They have been progressed over the time, and now the limit of detection is getting really low, so it can even detect non-significant exposures or consumptions. So I think it's important to homogenize the data collection for effective comparison.
Right. Okay, yeah.
I would like to add to Nerea's point regarding the standardized indicator for comparisons. I think it's very important to establish platforms for sharing databases and research findings to all researchers from various backgrounds. For example, the researcher from economic background, maybe they want to know the differences of the price of tobacco affect smoking initiation or quit ratios. Then we could collaborate from epidemiologists and economic background. Also, maybe behavioral science could be useful. But from my research experience, most important things to have an accurate and comparison available data set for sharing is very important. This is my point.
Maybe, Robert, do you want to give your insights using the systematic information systems to tobacco control research?
Yeah, thank you.
Maybe you can explain your experience.
Thank you very much. So, I'm happy for inviting me to be part of this roundtable. So it's a pleasure for me to be here and learn from all of you. From my point of view, I will identify myself more a quantitative person, but also I'm a geographer, and everything occurs in a space. So when I say everything is about quantitative data are come from a particular region, but also ideas and feelings that can be assessed through qualitative techniques also occurs in a space, has specific characteristics and is under different connection or relationship with other things that also has place in the same location. So that's what I investigate using the geographic information systems. So and from my point of view, both types of different techniques can complement each other. And yeah, I think depending on the research question, so we can use one method or another. But all the methods I think are important, and having different types of methodologies, quantitative, qualitative, and etc. So I think is the best tools that we have for achieve a tobacco end game. So using them in combination and using mixed methods, I think is the most. I think is the way to progress. So we can complement each other and learn from each other as well.
Thank you. And Rebecca, if you want to add some points to this question.
Yes. I'm going to toe the party line and say mixed methods is probably the best way to adequately reflect a landscape of tobacco consumption and cessation. My work is possibly a bit more qualitative. I largely do interviews with participants of smoke-free home studies at the end of a study, and I think this gives a lot of richness to research. You can really get to know the people that are attempting to quit smoking, to reduce their smoking, to move their smoking outside. And I think understanding their motivators, their barriers, it helps you design the next study better.
Right. So some of you are interested in health inequalities in tobacco use and secondhand smoke exposure. So how health inequality should be addressed in research studies, and which group do you think are particularly vulnerable to tobacco industry. And maybe, Rebecca, you can start this time because you have experience in the study of health inequalities in smoke-free homes. So
I think sort of globally we see health inequalities, but at a local level we do as well. Certainly in Scotland, where I do my research, lower socioeconomic groups, there is high prevalence of smoking, and I think it's definitely something that I think we need to bear in mind when we're looking at smoke-free generations and aiming for that 5% or lower globally and within each country. I think we need to look quite critically within certain areas as well to make sure that that 5% is reflective throughout a country rather than just overall.
Right. Nerea, would you like to continue?
Yeah, sure. Well, I would like to mention a recent publication I found regarding initial perceptions on the endgame goals in some countries such as Finland, Canada, New Zealand, Scotland. They found out that there was a limited progress in the reduction of ethnicity-based and socioeconomic disparities in each country. So I think we should focus on some specific at-risk groups, such as those with low income, a low level of education, or marginalized communities, because as my colleague said, they used to have a higher prevalence of smoking and significant disparities in the health consequences. So I think we should get their engagement with representatives of these at-risk communities to integrate them in the design, in the implementation of policies to make sure that they are culturally tailored to them and adopted in the right way, and also, as it was mentioned earlier, to provide financial support or free nicotine replacement therapy, or behavioral support, some digital techniques, and also not only focusing on smoking consumption, also on secondhand tobacco smoke exposure to protect public health and vulnerable groups such as pregnant women and children.
Thank you. Do you want to add something, Roberto, about your studies? You have a study, health availability and accessibility differs according to socioeconomic difference in an area. So I don't know if you want to add some point to how to address that inequalities in terms of availability and accessibility to tobacco.
Yes, thank you. So first of all, I'm just trying to address this question from a more general point of view. And I think on tobacco as a social behavior, as I mean, it's also happening in a place from a geography perspective. So you can find smoking cultures differ across different territories. So tobacco is rooted in a place in a different way, and tobacco has a different value for these communities. And of course, inequalities exist, as my colleagues mentioned, and I always think that when looking at these inequalities, what is behind that inequalities is that tobacco has a different value for that specific communities. And with value, I mean, for example, economical value, because tobacco is a financial product, commercial product, and it's also related with economy at some point as well, but also has a value because tobacco is used as a tool to cope with life for specific socioeconomic deprived neighborhoods. So these kind of values also differ in the territories and communities. So so when we look in a specific studies, as Xisca mentioned, so for example in the city of Madrid you can find that tobacco as a commercial product is present in the space in different ways. The first way is about in tobacco production, so tobacco harvesting is located in specific areas. Also, tobacco manufacturers were producing the cigarettes and the new tobacco products we talked about before, like e-cigarettes, etc., is also rooted in particular areas, industrial areas. Also, tobacco is also present in the space by shops that sell tobacco, so we call tobacco availability, and specific neighborhoods are most affected to this tobacco availability in their area, and there are some factors influencing this tobacco availability in the space. And also tobacco is present in the space through customers, so that we have also second-hand smoke exposure, so we are exposed to smokers in the street, so we can see them. It's also another way to be exposed to tobacco. And also, of course, tobacco advertising, which is banned in some places, but not in others. So again, we have inequalities in the legal landscape across territories, and these are other factors that can be analyzed geographically. So that's my general point of view from geography as well.
I think even in the access, when you want to buy tobacco, in some neighborhoods are more easy than in others. So the example of the chinos, if you want to explain to the audience, because maybe they are not familiar with that.
Yeah, so in terms of the legal framework of the stores that can sell tobacco, so here in Spain, for example, the tobacco sales are restricted to estancos, which are tobacconists, and that tobacconists depend from the government, and the location of these tobacconists are guided by license. It's a license system, and the location of the tobacconist and also all the sales that they have, so is related to the government, so depends from the government. But in this landscape, so there are also some stores that can sell illegally tobacco that we call, for example, the convenience stores as well. And these convenience stores illegally selling tobacco also appear in certain areas of our cities, like more deprived areas. So it's also a process occurring behind that as well. And yeah, I think...
Great. And Sophie, I'm particularly worried about new tobacco products promoted in social media addressed to new generations. I think it's a big challenge because it's very difficult to regulate. So I don't know if you have think about how can evidence that problem and how can we report that in our studies.
Yeah, thank you.
Even how can we regulate it?
How can we regulate it is a hard one. So for those of you that were present at the COP this year, it was a topic of conversation. And of course, the issue is that social media is transnational. And so how can you regulate something that crosses multiple jurisdictions when those jurisdictions can't agree on how to do that? But we have seen local level and regional level regulation that works to some extent. So in the UK, and I'm ashamed to admit this, but I find it entertaining sometimes to look up the various heated tobacco and vape companies in the UK and watch their Instagram, Facebook, Twitter, and TikTok accounts go up and then go down and come back and then disappear again. So to some extent, it must be working because they are trying to enforce in the UK the ban on advertising e-cigarettes and tobacco products on social media. But using the UK as an example here, there are still flaws in the system. So for example, we've talked about this a lot today, particularly in the nicotine talk, making sure that the regulation around advertising and promotion is all-encompassing is one of the biggest loopholes that exists. So take heated tobacco products where The regulation might cover the tobacco stick, but not cover the device. And in the UK, our own government has said to, for example, Philip Morris, you can't advertise on social media. It falls under a tobacco product. Please stop doing it. We will take action. And Philip Morris said, we've spoke to our lawyers. We think we're fine. And the government did nothing. It's continued. I'm currently compiling a list of it to put to the consultation. So yes, tightening existing regulation to make sure all these new innovations are covered is probably the first step on the way. How do we regulate transnational social media? That's probably something for COP rather than for me.
I don't know if some of the other of the speakers want to add something to Sophie's opinion.
Yeah, I would like to highlight a recent report from the Spanish Association Against Cancer, which mentioned that during a period of 6 years, over 50 million Spanish young people were exposed to tobacco-related content from top influencers from different sectors, including lifestyle sector. So I think it's these alarming statistics underscore the importance of regulating the marketing of tobacco through social media, because many young people, minors, are using social media, and also through movies. I can see, I have recently noticed a lot of movies where actors, actresses are smoking, so I think they should clearly labeled sponsor content. I think influencers should mention if they work with tobacco brands, and also I think it's a good example there is a good example from India, which they are requiring health warnings before, during, and after tobacco scenes. And I also think it's important to mention that in most cases, when actresses and actors are smoking, they are fake cigarettes. So, yeah.
Ayaka.
As we all know, it's very difficult to regulate on advertisement on social platform. So I would like to introduce my experience from it's not personal, but my additional work. I participate in Cancer Prevention Awareness Initiative as a youth ambassador at European Cancer League, and I've met many young, passionate individuals from various backgrounds who were deeply committed to public health in cancer prevention. And then I think I learned from them improving media literacy for youth as a consumer for tobacco industry nowadays, implement educational programs both in schools and online to help young people understand the impact of advertisements and the marketing strategy from tobacco industry. For example, they introduced me, there is one good movie, it's called Thank You for Smoking. It's from Elon Musk, and that is very good for youth to understand, how the tobacco industry manipulate us. And then they are young, they are easily to be influenced, but they are not stupid. So this kind of implementation that would be effective rather than regulation. Of course, regulation is very important, but it's very difficult. So these kind of awareness initiatives could work, I think.
Thank you. Now I would like to ask you more general questions that you are free to answer, all of you. I would like to know which challenges we will have to address in tobacco control research in the next 5 years. So everyone can start.
Well, I think considering all the aspects which were mentioned during the day, I think it's very important to implement and to do to keep doing research not only on tobacco consumption and second-hand or third-hand tobacco smoke, but also about the long-term health effects from e-cigarettes, because I can see that a lot of young people mistakenly believe that they are a safe alternative to traditional tobacco. And I also think it's very important to implement smoke-free private homes, public housing, and car policies. We have examples from other countries, European countries, some of them have already implemented the smoke-free car policies. We have a good example from United States and also Canada about the implementation of smoke-free policies in public housing. And in private homes, as it was said, it will be more difficult because of the individual rights, but I think that providing educational campaigns about the effects, that not only health adverse effects, also financial and environmental impacts. So I think it would be important to highlight this on research as well. And another important aspect I would like to mention, considering the example from some organizations and hospitals in the United States, is the non-smoking hiring policy. So I think it's important the fact that they are testing some employers to see if they have quitted or if they have enrolled to some cessation programs, otherwise they have to pay a fee. So I think that's another important thing. And then about the increasing the age for the purchase, I think that's very important as well, following the examples from New Zealand and now from UK, which will come into force by next year, not only with traditional cigarettes, also with vapors. So I think especially we should focus on the long-term health effects from e-cigarettes.
Yeah, Rebecca.
So I think the challenge that I see is also an opportunity. Is it on? Oh, sorry about that. As you said in your introduction, I'm very interested in public engagement, and a lot of my qualitative research involves talking to people about how they find interventions. And I think as an early careers researcher, public and patient engagement, PPI, is very normal to me. And I think one of the challenges that I face is bringing it to more established researchers and hopefully being able to show them the value of engaging with people that are affected by policies. And I think with tobacco control, that is smokers, people trying to quit, but it's also the general public. I think these policy interventions do affect us all in terms of secondhand smoke, in terms of people that we live with, and just out in public spaces. And I think, another challenge is making sure that our new policies that we introduce don't create new health inequalities. And I think engaging with the public can help us understand where those tensions might be and hopefully help us avoid them too.
Thank you. Yeah.
It might not come as a surprise as here representing TCRG to talk about industry science and the influence on science for profit. I think over the next 5 years especially, we'd love to see more progress towards protecting science, because I think we can, as independent researchers, can continue to conduct the excellent, valuable research that we do on the products and on the practices of the industry, but that is an uphill battle against the flood of industry science that will try to skew the database and impede any public health policies that look to undo the epidemic that they have caused. And so I think any research that strives to improve practice within research itself is also very valuable, particularly in the next 5 years.
Thank you. Maybe in relation to your point of view, I think it's important to advocate in tobacco control as researchers to transform our results in actions. We cannot stop after publishing our data. We need to go next step. So how to go from research to practice and how to minimize the gap between evidence and practice.
Yeah, thank you. So this comes from some experience I had recently. I'm hoping that some people in the room may have seen my recent work on Philip Morris Japan and exposing their secret covert science that they were conducting in the region around harm reduction and heated tobacco. And what was essential to that being so impactful was disseminating it to be able to influence practice. And I would say the biggest thing that we can do as researchers to help that is firstly be clear and concise. We are academics, we love to ramble and to talk about our research in such great depth, but often for lay people, even for policymakers, that's too much detail. So having really concise abstracts and conclusions that can then be utilized in press and lay audience media is super helpful. And then the second thing that's also helpful is to actively engage with groups and people who can actually access the public. The public cannot often access our academic papers, even when they're open access. By access, I really mean, can they understand the paper? And so we're very lucky in our group to work with Vital Strategies as our comms team. We also have our own in-house comms team, but also we work really hard to maintain relationships with journalists around the globe. If they reach out to us and we can't help them, we'll still keep them as a contact, because you never know, down the line you might publish a paper that's really pertinent to that region from where they live, and so it might be worth reaching back out to them to see if they would be interested in disseminating your research. Yeah.
Thank you, Sophie. Roberto?
Yeah, thank you. So just to add what Sophie was saying, so I fully agree with her. So just to add what Sophie said and bring some connections with the first question, I think we have like a lot of methodologies that we can use to display and convey our results in a fancy way that and concise way as well. For example, we can use technologies like, so we can use already infographics, videos, cinema. We can use also interactive mapping platforms that can reach a broad audience very quickly. So we can use these technologies as well just to widespread our results to the lay audience.
Thank you, Roberto. Ayaka, would you like to add something? Don't worry. So I have here in front of me 5 young researchers well committed to tobacco control, but we need much more people like you. So can our society involve young people in research, and particularly in tobacco control research? What can we do?
I'll go to schools is number one. It's something I do. I find that not only are you educating them on something, so usually I'm going to give a talk about e-cigarettes or heated tobacco or nicotine pouches, but by doing that, I'll often get emails then from those students saying, can I come do my internship with you guys? Can I come do my work experience with you guys? So I think this speaks to Becky's point about community engagement is really essential to getting the next generation of tobacco control researchers, not to be confused with the next generation of nicotine users.
Other opinions? Nerea.
So as they said, I think it's very important to instill in the importance of investigation from early ages. when they are at the school, doing some maybe easy essays or basic research about topics they consider important or relevant to create inquiring minds. And also I think there are some key aspects when doing and continuing research, which are to feel passionate about a specific topic, to understand that they need to be patient because sometimes things cannot get as quick as we would like to, but hard work always have its rewards, and also to feel motivated. I think that's very important. To understand it takes sacrifice as well, and also I think it's very important to have the person, for instance, directors support. I think that's really, really important to make sure they achieve their goals. And there will be challenging moments, but if you have your director support, as I luckily had, it will help to finish the PhD studies, for instance.
Yeah, just in line of my colleagues, just to add one thing that we need to review to keep young people in research is simply work conditions. I think they're very important because doing the PhD is not easy, as they mentioned. And there are a lot of difficult moments, and not all of us are similarly equipped to cope with these difficulties in terms of family issues, health issues, psychological issues. So I think it's very important to be aware of these inequalities as well within our capabilities. And I think improving work conditions can be a good way to foster young people to be involved in tobacco control research and research in general. And so I also agree with all my colleagues.
I think this is a key issue, especially the situation we have in Spain. So people who have conducted the PhD here, I don't know in other countries, but it's not easy to start and continue in the research career, and then to have an established position. You have to fight it. So I have a last question related with the topic of the symposium today. Then I think we have 5-10 minutes to the audience if have questions for our speakers. So it's related with one of the questions I made before, relation the challenges in 5 years. But now, in 5 years, if we look back, which actions would you like to say that have been taken in tobacco control? Yeah, so if you look back in 5 years, which actions would you like to say that have been taken?
I'd love for the tobacco and vapes bill to be passed in the UK. Very selfish, but that's, yep.
I would say try to control the message, because I feel that we as researchers, we are always one step back on the tobacco industry. So I think it's very difficult for us to chasing them, because they are releasing new tobacco products, and it's very difficult for us to keep evidence update. So, but at least I think we can trying to address conflicting messages related with tobacco use, and I think also that will help for the society to be well informed and not have this the information. I think that would be a good point to address in 5 years.
Great. Akaya?
So I would like to add what Roberto said now. So I would like to advise well, like of the packing that they strength timely monitoring and the surveillance of product-specific usage. As Roberto says, in last 5 years, the emergence of new tobacco products occurred. So, like product-specific usage is a key to monitor and address the policy action. So, those kind of surveillance could be strengths.
Nerea?
Yeah, and I think I think now there is more awareness about the health adverse effects from secondhand tobacco smoke exposure. So as I said before, I think it's very important to implement smoke-free policies in this aspect, and also to keep increasing the tobacco taxation, because I think is one of the most effective policies, as it was seen that by decreasing the price by 10%, by increasing, the price by 10%, consumption decreases by 5%. So I think that's very important. And then also, as I said before, increasing the age from which the tobacco can be purchased as well. I think it's very important.
And Rebecca?
I think I'd like to add to Sophie's wish that the tobacco and vape bill goes through. I would like to see the smoke-free generation go through as well, because I think they work hand in hand, and I think without that commitment to raise purchasing age, the bill, there could be some issues there. And I think just generally with those commitments and general commitments globally, just the support for nicotine cessation as well. I think more money needs to be invested, and it would be great to say in 5 years' time that all worked perfectly.
So thank you. Now we have 5 minutes left, if the audience want to do some questions.
Thank you all for sharing your experience. Could you, each of you, briefly share one of the recent instances when you were interacting with anyone outside of the bubble and that you felt inspired and motivated or proud of the work that you do? Any sort of specific example, whoever, if nothing comes to your mind, you can just pass the microphone to another one. Thank you.
This comes from the Philip Morris Japan thing. I got sent by quite a few family and friends, like the Guardian coverage or coverage in various news outlets around the world, not realizing that it was me. So they were like, you should see this, it's really interesting, you'd love this is your work, like it would be just like, up your alley. And I was like, yeah, it's because it's mine. So, but it was really just, I felt the impact. It was fantastic.
So I guess similar, people send me stuff now. They see my work in public and they can attribute it to at least my field. And that feels really nice. I used to be an art librarian and everyone used to say, oh, that's such a cool job. But now I feel like I'm doing something that's actually a lot more meaningful, and it's nice to have just people in my broader sphere recognise that too.
Yeah, I think it's nice when you can see that people, when you talk with some students or friends, that they didn't know about, for instance, in my case, the effects from secondhand tobacco smoke exposure. So when they see on the news or some publications and they are interested and they ask, what did you find? And it's nice when you can share this knowledge to people who didn't know about it, and you feel they are interested.
Thank you. I think it's so glad to have a group of enthusiastic young researchers with us. You know, I always have one question in my mind, linking to this region, the WHO European region. You know, the prevalence of smoking among the females is the highest compared to other WHO regions. So I always have a question. So why the female? Why we have such large number of female smokers? And second, as a cessation person working in cessation areas, how could we help them stop using tobacco or cigarettes? So would like to ask any of you, say, do you have any interest? Do you have interest in finding out the answer, or do you have any suggestion to find out the answer? Thank you.
Easy questions.
Do you want
Do
to answer?
anybody wants to respond
Yeah.
before I pass?
So in terms of the difference in the prevalence between different sexes in Europe, I think that responds to like a theory that explains how historically the prevalence evolved through time, and particularly in Europe, in the middle of the 20th century, the prevalence was so high for men and very low for women. And then in the 70s, 80s, it depends on the country, so associated with a more heavy marketing campaign to targeting women related with empowerment, and so the prevalence of smoking in women increase, and the prevalence for men tend to decrease. And I think now at the moment, so both of them are very similar, but probably slightly higher on women. But I think it depends on the country. Yeah, I don't know if any.
Yeah, I think so.
Aim right now, what PMI says in its private documents, forecasting profits, they know where they can make money. And it's selling to women. It's selling in countries where women will associate tobacco with power, especially Asian countries. Women are getting access to education, and they're selling the same message they sold in the States in the 70s. You've gone a long way, baby. So that's number one. Number two, the interviews that I've done is that there are a lot of young women who are starting to smoke in Spain, especially around 14 or 15, for exactly the same reasons that people started smoking in the 50s and 60s. Be cool, look older, and hook up. But the young women now also are doing it for weight control and performance. They use nicotine to study and get good grades and compete. And then when they're about 18 or 19, they realize they're addicted, and it interferes with their lives. So we have a lot of messy stuff going on right now, especially in Spain. A couple of the doctors I've spoken with look at the hormonal reasons and the way our brains work differently than men's brains that make it more difficult to quit. I can hook you up.
Question we touched a bit upon it in your discussion. So there is a saying, he who frames the debate wins the war. So it's not enough to generate sound evidence now. We need to communicate effectively about it. Yes, correct? And then you mentioned, Sophie, that we need to be concise, to the point, and you, Roberto, told about different mechanisms to use. But any insights on how to make research resonate more strongly, specifically with policymakers in the times when they have so much on their agenda? I mean, this perma-crisis, which Angela mentioned, emergencies, wars, everything, climate change, everything. So how do we keep tobacco control up? Any thoughts?
I think it was maybe Becky I was speaking to about this earlier, and to you, Lilia, I think as well. Something we're trying to do a lot when presenting or giving talks from our group is when you're in a room of people who might not agree particularly on products like e-cigarettes, like heated tobacco and nicotine pouches, often you can bring those people together by taking the perspective of the industry and saying, okay, well, we can't agree whether the products are good or bad, but we can agree that the industry selling them are majoritarily bad. And that tends to bring people together even when they have huge disagreements on the products themselves. And the more people that we have together, the better chance we have of influencing policy against the tobacco industry and in favor of public health. Am I making sense? Yeah.
Yeah, Rebecca.
So I think on that, you have to remind the public that it's still a problem and get public buy-in. I think I talk to a lot of people with my alcohol hat on, and when you talk about tobacco, they're like, oh, we solved that problem. And I think that's a massive barrier that, especially in the UK, people think that rates are low and that we solved it, and we haven't. So, yeah, it's keeping people engaged in that.
So I think we run out of time. So if you agree, we can close the session here. Thank you, all of you, for that great session.
Much, Xisca Sureda for this table. We are going to do the closing of the symposium. I would like to ask the authorities that come to the table, please. We have Esteban Fernandez, we have Dr. Guyon, and also Dr. Capellà from the IDIBEL institution. And thank you for all of you that you are still here, like surviving, you know, this long day. Okay. No. So I have with me the same people that we did the opening of this symposium. So we are very lucky because the two main authorities of public health have been here all the day. That means how sensible are with the topic. And we also have another representative from our institution here from the IDIBEL, and we have also our colleague Angela, that together we have prepared the symposium. So we want to do like the final remarks of the symposium. First, I start very briefly by saying thank you for all attendees, those that we are here and those that they are online. And thank you, I think that we need to acknowledge the team of the Tobacco Control Unit to organize this symposium. And please, I will ask you an applause for them. So it's a great team, and it's a great opportunity to work with them. This is only an example of everyday effort that we do in the team. And in the case of the symposium, I think that we have organized this symposium together with WHO with a lot of enthusiasm in order to gather all the topics that we have seen today, including the review of after 20 years of the FCTC, how we are doing. Also, it has been very interesting, all the illustration of the new emerging products that are not emerging, are on the market. So we need to change the name. It's not an emerging thing. It's something that it's a reality. And we are facing this reality, and we need to do something. We also have reviewed how to regulate the smoke-free policies in places that are not regulated. And we have seen that there are like solutions like smoking cessations that sometimes are not very well implemented. And we can use implementation science, that it's something that helps in the implementation, not only to smoking cessation, but also to other policies. And finally, it has been very nice to see how we have people and young researchers that are going to continue with these efforts that we have been working for years. Many of us have been working 20 years in this topic, and others even more. So imagine how long trajectory it
enough. And the second thing is that not everything is about convincing policymakers. Political will is not enough. Evidence is not enough, and political will is not enough. We are moving with different things, standards, or different things that can happen when we are doing policies. For example, and I think that's the whole perspective on this. Politics and policies are about power. Every time they are about power. They are not about evidence, or just not about evidence, and not only about political will. We need power. We need the power to do these policies. And we need this power to implement these policies. For example, and I've been very keen to tell you that we need a critical society against tobacco. We need a critical society against tobacco, and we need to create these alliances. And for that, I said from the beginning that this is very important. This is a very important event, and all of the events that we can have over here are really important in creating a critical society against tobacco. Because it's not only political will, it's not only about evidence, it's about creating power. And that's important. And we know the strategies of the industry. I was showing some pictures to some of you before that there's a big bus that is coming through out the ministry and the parliament in Spain with the vaping industry calling us Ministry of Tobacco or Ministry of Death, just because we are going to regulate vaping. And we want to do that, and we want to be able to do that, but we need also to create these kind of different narratives that can fight the narratives that the industry is having. And the only way of doing that is with a critical society and with the alliances of research, policymakers, and civil society. And we have to make all our efforts in that, because that's the way that we can advance in tobacco control policies in the next years. So taking the message of this symposium, that is how to take decisive actions to move for tobacco control, I think that the most decisive action that we can do is to create these alliances to move forward in tobacco control in the future. Thank you very much.
So with these final remarks, so as I was mentioning before, safe trip homes, and see you for the next 8th Eco Symposium in 2026. Oh my goodness. Thank you very much. Bye-bye.
And I was very encouraged and very happy to hear the speeches of the young researchers. And we as a WHO, we also try to promote it. And the next year we'll have a small project, just small project in 2 countries, piloting how to help the researchers in the countries where they have data to do more, to generate the evidence, what they have. Therefore, I was very encouraged by your experience and your words. Thanks for coming here. The second point I would like to mention about the changes and the support. We as a WHO, we try to provide support to every single country. Great that you will continue to be and you are stayed forward to strengthen the tobacco control measures. Yes, because it's not just a harm to do the wrong things, but a harm to do nothing. Therefore, it's great that you are moving forward. Thank you. And we as a WHO will support every single country with what we can, and we'll stay committed. Not we as a regional, because we have the country offices in some countries and the colleagues from the headquarters. And also, but the changes coming from each of the person. Therefore, you as a person, don't be just neutral. Participate in everything you can. Because if we, as a person, will do some changes, as a person, in the family, in the bigger, will make a change. And the third point that I want to focus, because we are close to their Christmas and to the New Year, and I would like to wish you all the best and happy Christmas and New Year in your family, with your close friends, and so on. All the best to you. And thanks.
Thank you, Angela, for your words and also for your support. And I want Dr. Pedro Gullón, General Director of Public Health of the Ministry of Health here in Spain, to do the closing.
Buona tarda, good afternoon to all of you. I would like to start by thanking all the organizers of the event, starting by WHO and also the Catalan Institute of Oncology, and especially Cristina for everything. It has been a real pleasure to be with you all day. It's not so common, as said Cristina, that I'm able to stay all day in one event. I had to leave for a couple of hours for some meetings, but it was amazing to be here, and it shows the commitment that the Spanish government has now on tobacco control. Here we have seen the gaps in research, the gaps in action, the gaps in implementation, in evaluation, and even we have talked about the future by having a table of early career researchers. That's amazing. That's amazing, and I think we have to be very proud, all of us, from different perspectives, to be able to have this gathering and have this symposium, because it makes, so it's a lot of effort to organize this, and sometimes you don't see if that makes a difference, but it makes a difference. I said in the beginning, in the morning, that all the alliances that we can create through this kind of symposiums are really important. While we have to do the policy and implement this policy and evaluate these policies. I want to say a couple of things about the next steps in Spain, although some things have been spoken throughout the symposium, but I think we have a great opportunity to get new things done. For example, we have the advances on new legislation in these kind of new products. I don't like to talk about new products because they're not new, but about the new products that is coming, help in the first quarter of 2025. Now it's in public hearings, so everyone can make amendments to this legislation. But also in next year we'll have a new law on smoke-free spaces, where we can see how can we advance on smoke-free places, as some of the speakers have said, and especially I like very much the presentation of María José López on the things that we can advance on that issue. Also, we have made advances on taxation. That is something that did not happen in Spain in quite a lot of years, and the Ministry of Finance decided a couple of weeks ago to advance on taxation policies, and we're very happy on that. And also, we have made advances in how to change narratives on tobacco control, and that's something that is not easy. And maybe at the end, I will talk about a little bit about that. But at the same time that we have made great advances, or we are making it right now, there are some things that also have been maybe challenges that we had, or even step backs in tobacco control. And we talked about that this morning. The legislation that passed on the waste of tobacco products, where the industry now has the ability to organize that. And that's a fight that we had between different ministries, because the government has this kind of things, and we lost that fight. We are still trying to fight it, but some things that happen, some things you lose also in the fights. But you have to be really aware of that, and we have to be very active in pursuing these things, because we don't want that to happen. And just to finish in these closing remarks, I want to say something about making policies. I read an article in Science last weekend that talked about that it's not only that politicians do not care about science, because that happens. It's also that researchers didn't know anything about policy, and that's a big issue. And I have both hats, because I'm now a decision maker, but before being that, I was an academic, and I worked in the University of Alcalá with Xisca and the team over there. And I've learned throughout this year that a couple of things that are so important to understand how to make policies. First of all, evidence is not enough. Evidence is not enough. Even if we do it very clear, very funny perspective of showing, evidence is not enough.
Inception of the Catalan Institute of Oncology, cancer control and prevention was a mainstay here. So whatever is built here in this field of epidemiology, cancer control and prevention, is built on the shoulder of some giants that came here some 20 years ago. Early in that step, Dr. Esteve Fernandez, and now is sitting close to me and has this special political role, has been crucial to make tobacco control happen in our institution, but I have to say that with a strong endorsement from the institution. From a very much more personal tone, if I may, I always tend to explain some seeing him walking in the outdoors of our facilities, and all in a sudden he finds somebody that is hiding and smoking, somebody that probably is coming out of either the radiotherapy facilities or, because this is a huge building, we have a huge social facility here. So there are people that tend to smoke. He's among the few of us that he would come in a positive and assertive manner and talk to them and saying, you should not be smoking here. And I have seen some of them, and sometimes I do not. So this is a small token of his commitment with tobacco control. Having said that, what's important here is that, and with my hat on the IDIBEL and research, the foundation of any policy must be made on knowledge, and this means research. And this is what is happening here. This is our research institute is linked to healthcare providers, a monographic cancer center, the Catalan Institute of Oncology, a tertiary care center on the other side of the highway, that is the University Hospital of Bellvitge. And we are a community of 1,400 people. Out of these, half of us are dedicated to cancer. And we have identified two main programs in this area. What we call the Oncobel, that would be what is not the Epibel, that is the epidemiology of cancer. So for us, it's an identity mark to have a research program on cancer epidemiology that may include etiology, but also cancer control and prevention. We are proud of this, and we are very proud of hosting this symposium because it attests to this commitment. And I would say just 3 more words. So in 2021, if I am not wrong, Europe's Beating Cancer Plan was launched, and there this attractive idea of a smoke-free generation was launched. It is, I would say, moving somehow that so many of you are committed to achieve this, which I see as a very difficult endeavor. So I just would like to encourage you on doing this. The second concept is that I have seen in the program is the implementation science. I tend to find it easy to understand what it means and difficult to explain what it is. So I have mixed feelings of this. But clearly the idea of learning while doing and then drawing lessons from this and trying then to inform whatever the decision is made by the policymaker is a good idea. And I think, I consider that probably this is what is underlying the idea of the implementation science. I would say that just do it and provide the best evidence for policymakers now, Esteban, to go and make the right decisions and push forward the best strategies to mitigate and eventually end with this pandemic that is the tobacco smoking. So again, my congratulations on the symposium and my best endorsement to generate the knowledge that would translate into an effective policy that would somehow control this pandemic. Thanks.
Thank you, Dr. Capella. We really appreciate your words and also the fact that we know that prevention is an important part of the debate, and also later on, if you want, I can explain you what I have said about implementation science. It was very brief. Okay, so the last person, and the next person I want to make the final remarks is Angela Giovano from WHO, who has been with me and the rest of the team designing this program. Hopefully that will be interesting for you, because it's not easy to think about the topics of a broad topic as tobacco. Tobacco has a lot of, like subtopics, and we were thinking, okay, what we should introduce in this symposium. So Angela was very determined in order to think about the topics and also the speakers.
Yeah, thank you, Christina. And also, as the closing remarks, I also will start. I'll focus on 3 things, but I'll start with thanks, because first of all, thanks to our hosts for accommodating all of us here, for bringing all of us here, for treating us well during the entire day, and for having quite good lunches also in the between. Thank you. I also would like to thank my WHO colleagues who came here, who presented wonderful, interesting information and share the experience. Thank you, all of you. Thank you, my colleagues from the other NGO, the key NGOs. But all of you that came here, sure.
It has tobacco control right now, and how much it has changed in the last years. I want to say that thank you for for your attendance, and I hope that you have safe travels and see you soon in the next soon in 2 years, in fact, in the 8th Eco Symposium, hopefully here again in our institution. So, and I give the floor now to our authorities, Dr. Fernandez and Dr. Guillaume. Probably Dr. Fernandez.
Thank you very much, Cristina, and thank you very much to all the colleagues in the final table, in the closing table. But of course, first of all, thank you, as Cristina said, to survivors, to the symposium. It's great to see that almost 5 p.m. More than half of the attendees still remain here, and I believe that one of the big things of the symposium is to attract the attention and to be able to concentrate here during 6 or 7 hours, people wanting to share experiences, learning and sharing. So I believe it has been a terrific symposium. If I should write a tweet or something in the new network, in Blue Sky, I had written this. And I believe that the goals of the symposium have been accomplished. Cristina was making the list, but in summary, we have had interesting tables in the different topics with great presentations, very well moderated, and also with an excellent lunch. Also target to facilitate people interaction and so on. So I believe that it is quite complete. It has been very complete. In this moment we are at the crossroad with new paths towards tobacco control after many years of the FCTC, national legislation, supranational legislation or indications from the Commission in the case of Europe, and we are moving towards tobacco endgame. So we have seen diverse aspects of tobacco control, including the fresh vision of young researchers that are engaged in tobacco control research at this point, and that they will be contributing during the next 5, 10, or 15 years. In fact, one of the questions I had is, if you had a permanent position and 300,000 euros per year during the next 5 years, which would be your next study? But I didn't make this question. But my suggestion is to all of them to think about it. So I believe, I believe things, but it doesn't matter. What I want to express now is the full commitment of the Secretariat of Public Health from the Department of Health here in Catalonia to advance control in our country, in Spain, and of course trying to have incidents also in Europe and worldwide. We are doing our best. We are collaborating with the nation's government to promote new legislation and to make tobacco control something not restricted to one single day, to the first 30, the World No Tobacco Day, 31st of May, okay? But we want to expand this through the whole year. It's a moment in which we need more legislation, strong legislation to be enforced, to be implemented at the different levels, at the national level, the regional level, and also the municipalities have to contribute, but also to change the minds or to change the behavior of people, not smoking or smoking, but the behavior towards the fact of smoking and no smoking. We are at a good point. All our experience, I believe, has brought us to a point in which we can have new gains for tobacco control. So it has been a pleasure to be here participating from early in the morning, and I took with me several messages to be applied. Thank you.
Thank you very much, Esteban. It's our pleasure to have you here again at your home and with your team also. And yes, we invite also to speak to Gabriel Capella. Dr. Capella is the director of the institution IDIVEL, that also many of our research goes to IDIVEL, and he knows how active we are sometimes in applying grants and continue with our group, that many of our team is not only from Mexico, half of them, they belong to this institution, IDIVEL.
Thanks. So first, I want to apologize for early this morning that Dr. Joan Brunet was not joining us. This weekend, he lost his father that was ill, and he could not make it. So here you can imagine that I am now under two hats. One hat from ECO and the other hat from the IDIVEL. And this is probably the same that looks as me, as I have two brands. So my personal interest is in hereditary gastrointestinal cancer, so I am very much into prevention. And one of the key things in this campus has been that from the very early